It's a concern for a lot of people, and sometimes even losing weight doesn't get rid of double chin. But there's something new garnering a lot of attention because of the results. Kybella, it's the only FDA-approved injectable treatment of its kind from Optima Medical Hormone Replacement and Aesthetic Center. Owner Jolene Lake and Chris Ewald is also with us. She's a licensed medical esthetician. It's nice to have you both here. You've both had this treatment done, so I look forward to inquiring about the difference you each saw. But explain to us in general, what is Kybella and what's it intended to do?
Kybella is an amazing new drug, FDA approved and the first and only of its kind, and it reduces that submental fat, or the fat under the chin, that gives us that awful double chin we don't like.
So that's where it's meant to be used. If I ask that question, where do you put it? That is exactly where.
Only under the chin at this point, yes.
So in terms of results, if people say, I exercise, I eat right, and yet that part of the body, it never goes away. So let's look at some of these pictures, Jolene, and would you explain to us the difference here?
Yes, so on the top is a man, you know, the front view, before and after on the left and right, and then the bottom, the side view. So he's had a slight reduction, I think. Some of the other pictures are a little
more contouring. Oh,
more
my
contouring.
Goodness, look at this.
And really you see a retraction of the skin as well, which is really a nice added benefit.
I mean, she looks 20 years younger.
Absolutely.
Isn't that remarkable?
We see so many patients that want something done for under the chin, and now we have a great non-surgical tool.
And here, I don't know how old some of these people are, but in some cases they still look fairly young, and so it's not always a case of age, right? That could just be something that's always bothered you if you look back on it.
Yes.
And here, yet more contouring. The confidence level's got to be huge for a lot of the people who embark on this, right? Where especially if they've always felt like, I don't enjoy this. Chris, what was the difference for you?
Oh, very minimal discomfort. It actually really helped just with one treatment already. So I'm very, very pleased with the results.
So Jolene, explain what is the process like? And we see here men and women too. I think that's a great example. Oh my gosh. I'm sorry to get distracted, but I keep looking at these images and how well Kybella works. But you put a little, like almost a chart right underneath. So explain the process. If our viewers come in,
absolutely,
what should they expect?
Kind of like a kid tattoo, where you put this on with water and then it leaves these dots under the skin, or on the skin. And those are the areas we inject. We mark off the treatment area, and that's how we figure out how much you need. And then what areas we need to inject to give you the best treatment.
On average, how many treatments are needed?
Most people need for sure 2. Some people do need 4. It really is individual because everybody's chin looks a little bit different.
So what result were you looking for, Chris?
I had a very small amount that I would like to get rid of. I've had my first treatment and will have my second one here in a couple of weeks. So.
And in terms of discomfort, you said it was minimal.
Very minimal.
What about downtime?
Slight swelling, but not really that much.
So you don't have to check out of life. If you have an appointment, then you can, I mean, could you go on without your errands or return to work, return to family functions? All of that was fine. And then from the point that you had that treatment done, how much time passed until you started to see a difference?
I believe mine was about 10 to 14 days I started seeing it, and then slowly the swelling went down, so I'm very pleased with it.
I don't imagine, Jolene, the FDA approves this if it's, I mean, obviously if it's not safe. So it's been properly vetted in research for a long time to make sure it was safe for everybody. But what about effectiveness? How well does it work, and are there some cases where you might not see it, or is it pretty uniform?
It's actually a great medication, very safe. Anything adverse that happens is reversible in all the studies that were done. So, you know, you can get a little bit of numbness in the area, a little bit of swelling, like Chris said, maybe a little bruising, especially if you're on a blood thinner. But other than that, everything goes back to the way it was, and your chin just looks great again.
Are there any risks you want people to know about?
Not really. It's a very safe medication. The only contraindication really is if you have an infection in the area. So
I understand.
We just be careful with the people we treat.
Talk that over. Do you have anything special happening?
We have a holiday event. We have a holiday open house on Wednesday.
Oh, cool.
So 9 to 5, we're doing a gift card sale and other specials. So if anybody wants to check out our website or stop in, that'd be great.
Well, for yourself, or I'm thinking too, if it's somebody you know well, right? If it's your mom or a sister and you've heard them forever talking, I just don't like this part of my body, and you wanted to get them a gift card so they could try Kybella. I think that's a thoughtful approach to it. But again, this is probably going to be for you, and we have something terrific with these, an offer. In fact, for Kybella, if you want to try it, purchase a treatment by the end of the year, and you'll receive a $100 gift card back to Optima. So maybe you get the treatment and then you give the gift card, because this is just one, but they have several services available there. So maybe you would want to use the gift card for something else. But let's show you some information. We have the open house coming on Wednesday, but you're welcome to swing by at any point, Monday through Friday, 9 to 5. Call 578-5353. But if you're new to Kybella or you're just new to Optima, all that information's online. It's optimamedical.us. Guys, thank you so much, and we're so glad you made it in safely, okay?
Thank you.
Jolene and Chris,
Thanks.
nice to meet you.
Nice to meet you.